Ceftriaxone is a third-generation cephalosporin antibiotic. It's one of the most commonly prescribed antibiotics in hospitals. In this video, we'll dive into how ceftriaxone behaves during pregnancy, what conditions it's recommended for, and what the data says about its safety while breastfeeding. The important question is, does it cross the placenta? Yes, ceftriaxone does cross the placenta. The placenta is an organ that connects the developing baby to the mother's blood supply, allowing nutrients and some drugs to pass through. This means the fetus can be exposed to small amounts of ceftriaxone during maternal therapy. However, studies show that while pregnancy causes certain physiological changes, like increased blood volume, faster kidney filtration, and altered drug metabolism, these changes do not require dose adjustment for ceftriaxone. So standard dosing remains effective and safe during pregnancy. Ceftriaxone is recommended for several infections during pregnancy. One key example is pyelonephritis, a bacterial infection of the kidney that can occur during pregnancy. If left untreated, it may cause serious complications like preterm birth, which is a delivery before 37 weeks, low birth weight infants, and maternal complications, such as acute respiratory distress syndrome, a severe lung condition, anemia, disseminated intravascular coagulation, which is a widespread blood clotting, and sepsis, which is a life-threatening body-wide infection. That's why guidelines from the American College of Obstetricians and Gynecologists recommend targeted antibiotic therapy, and ceftriaxone is a strong choice. Ceftriaxone is also a go-to treatment for other infections during pregnancy, including gonorrhea, which is caused by Neisseria gonorrhoeae, and a Lyme disease, which is a tick-borne bacterial infection caused by Borrelia burgdorferi. It may even be used before vaginal delivery in women at high risk for endocarditis, which is a dangerous infection of the heart's inner lining. However, this must be done under specialist guidance following official obstetric and infectious disease guidelines. While ceftriaxone is broadly safe, it's not recommended as an alternative treatment for syphilis in pregnant patients who are allergic to penicillin. This is because penicillin remains the only proven drug to treat both the mother's infection and prevent congenital syphilis, which is a transmission of the infection to the baby. That said, there are isolated reports where ceftriaxone has been used in such cases, but always under close medical supervision and according to evolving clinical data. Let's talk about breastfeeding. Ceftriaxone does appear in breast milk, but the concentrations are quite low. In one study, a woman receiving 2 grams daily showed a peak breast milk level of about 7.89 micrograms per milliliter. That's very minimal. Other studies found even lower levels, around 0.5 to 0.7 micrograms per milliliter. These small amounts are not expected to harm the infant, though they might slightly alter the baby's normal gut bacteria, sometimes leading to mild gastrointestinal disturbances like loose stools or mild diarrhea. Overall, major health organizations, including the World Health Organization, consider ceftriaxone compatible with breastfeeding when used at normal doses. However, the decision should always weigh the benefit of treatment for the mother, the benefit of breastfeeding for the infant, and the risk of drug exposure to the baby. In most cases, the benefits of treating infection and continuing breastfeeding far outweigh the risks. So to sum up, ceftriaxone is generally safe during pregnancy and breastfeeding, with no need for dose changes, and there is strong evidence supporting its use for serious infections like pyelonephritis and gonorrhea. As always, medical decisions during pregnancy or lactation should be guided by your healthcare professional. If you found this breakdown helpful, don't forget to like and subscribe for more clear medical educational videos.